With the end of the presidential election cycle, many of us are sure to be burnt out on the constant stream of political conversations. Taxes, immigration, and healthcare are all prominent topics that have been the focal point of countless campaigns. And while they have a great impact on Americans, there's another issue that's often overlooked, but hits equally close to home: water politics.
Water is a resource, a service that we all rely on in some way. And there's a whole network of policies in place to make sure, or decide anyway, who gets what amount of water, at what quality, at what cost.
That's Sara Hughes, a senior policy researcher at RAND, a nonprofit global policy think tank. Her recent work focuses on U.S. and global water policy. There are a lot of decisions that get made before water ever makes it out of our tap at home, like the supply source or the investments in water infrastructure.
These are decisions that policymakers are making, that communities are impacted by. And so these are places where politics play out too, where there's different interests at play, different resources that are brought to bear on trying to shape the outcome.
An outcome that can greatly affect our health and environment. However, water politics are often invisible to the public, at least until catastrophe strikes.
The Flint case is a great example of this, right? Where this fairly innocuous service of drinking water became this crux point of state, local, federal politics, right? This pipeline and these treatment processes and the standards and who gave the green light and, making all these decisions, sometimes driven by science, sometimes driven by economics, right? We need to cut costs, sometimes driven by regional politics. We want to be the decision makers. And so I think that's what these events also kind of help highlight, is that these aren't just kind of technical exercises. They're political in a lot of the same ways that we might think of other kinds of policy areas being political.
In 2014, Flint, Michigan garnered national attention for its contaminated drinking water that led to at least 13 deaths from the bacteria. The city had experienced financial troubles in the years leading up to this crisis and had been placed under emergency management appointed by the state. To help save money, the new manager decided to disconnect Flint from the Detroit Water and Sewage Department and build their own pipeline to funnel in the city's drinking water.
Problem was that there was this gap in time between when this new pipeline would be built and the present. And I think by then, my sense is that by then people were kind of decided, we're kind of done with this Detroit system. We want out. And so instead of staying with the Detroit system until the new pipeline was built, they decided, largely led by this emergency manager, but also, the city council is kind of coming along for the ride. But they decided that they would switch to the Flint River as their water source in the interim.
Which there was precedent for. Decades prior, the city had used the river as its water source. However, the water treatment plant had been sitting vacant for years, and the river hadn't been used as a drinking water source for just as long. The water wasn't treated properly and corroded the distribution pipes, which allowed lead to seep into the city's drinking water. Since the water never met federal standards, wouldn't you think that there would be fail-safes to make sure it doesn't get out to the residents? Sadly, Hughes says there's often a gap in how policy should work and how it's actually implemented.
I think part of the problem, and this is where I really think some of the lessons of Flint's experience come in, but it's this really big onion almost of a policy problem, is that the way the actual regulations and standards are designed for drinking water are actually fairly complex and not, I think, sometimes how we think they are. I think we think that, for example, the water that comes out of our tap is what we're really managing for. And in a way we are, but all the decision-making and regulation happens at the drinking water treatment plant.
Though lead pipes were outlawed in 1986, the EPA estimates that more than 9 million lead service lines still distribute water across the nation. Instead of changing the pipes, the treatment plants try to account for the contaminants that'll leach into the water as it travels by adding in chemicals that slow or prevent pipe corrosion.
That corrosion control standard is then supposed to mitigate the lead leaching issue. And so if it does or does not, then there's a testing process to see if it is actually working. The utility is supposed to go out and like actually test the water in different parts of the city to see if the corrosion control is working. But that's, it's like, that's what I mean by an onion. Then it's sort of like, then you get into what those testing protocols look like and the sampling protocols, and if they're testing in the right places at the right times, and if they're flushing before they test. It's sort of like there's so many layers to the process. And if any one of them starts to get out of whack, the whole system is off.
Hughes says the city's rush to get the new water distribution system up and running most likely created an environment where corners were cut in favor of speed.
I think the fact that there's not always this kind of like hard and fast go, no go rule, it makes it possible anyway to let the water out and kind of see what happens.
Though it seems irresponsible to take such a gamble when risking the health of the residents, Hughes says it was made possible through the fact that, before Flint, much of water politics was invisible to the public. Thankfully, her recently published paper in the journal The Forum shows how Flint's water crisis has brought water politics to the public's attention.
Flint's not the first community to struggle with high water bills or water contamination problems or not being able to trust their drinking water quality, right? Like some of these problems have been around for a while and we've been studying them, and a lot of my colleagues have been really focused on these, but it's been tough to raise these issues to the level of, national attention that they have now. And so I think that's a lot of what Flint's experience did too, is kind of make visible some of the issues that have been going on in communities already too, and kind of say, it's not just Flint either, or, this is a symptom of a larger problem maybe, and start having that conversation.
The first steps to improve America's drinking water came in the 1970s. Various laws were passed that led to a large federal investment in water infrastructure, like pipes and treatment plants. 63% of total federal spending went towards this effort. However, the hype quickly died down, and the initial 63% was reduced to just 9% by 2017. The states were tasked with maintaining the original infrastructure, but many have been slow to action. Additionally, the normal wear and tear of these structures after decades of use means that we'll need to reinvest in new infrastructure soon. Thankfully, a 2021 bipartisan infrastructure law contributed $50 billion towards this goal, the largest investment in U.S. water infrastructure in American history. Hughes believes the greatest improvement to come of this will be removing the existing lead service pipes.
To me, that's the biggest win, because there's just no reason for us to have lead pipes and have our drinking water go through lead pipes at this point. And so the fact that people run the numbers. I know that the funding in BIL is not enough to replace all the lead service lines in the U.S., but it's a start. There's a framework. There's a requirement. It's at least put the attention onto it in a new way. And I think prioritizing the solution of removal as opposed to, I think for a while there was talk of new treatment guidelines and testing guidelines, and those are in place too. But I just think having the removal as the preferred solution is a big win, and that's where we have to keep moving.
Community advocacy groups have played a huge part in creating these visible changes and keeping them front and center in society. If you're looking to add your voice to the case, reach out to your local drinking water organization. You can find more information about Sara Hughes and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.